Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 30 practice questions. With out the way, let's get started.
The nurse is discharging a client 2 days post-operative hiatal hernia repair. Which discharge instructions should the nurse include? Select all that apply. 1. Take all of the prescribed antibiotic. 2. Eat 6 small meals per day. 3. Use the legs to bend down, not the back. 4. Take esomeprazole twice a day. 5. Use the pain medication when the pain is at 8 through 10. The correct answers are 1. Take all of the prescribed antibiotic. 2. Eat 6 small meals per day. And 3. Use the legs to bend down, not the back. Prophylactic antibiotics are frequently prescribed both pre-surgery and post-surgery. The client should be instructed to take all the medication as directed. Hiatal hernia repair may not last, and the client should continue the recommended lifestyle modifications, such as eating small meals. Part of the lifestyle modifications for hiatal hernia is to limit pressure on the abdominal cavity, especially after a meal. Using the leg muscles to bend down, rather than bending over, should be taught to the client. Esomeprazole is administered daily, not twice a day. For the best relief, pain medication should be taken at the onset of the pain. The client should not wait until the pain is an 8 to 10 before taking the pain medication. The client reporting acid when lying down at night asks the nurse if there is any medication that might help. Which statement is the nurse's best response? 1. There are no medications to treat this problem, but losing weight will sometimes help the symptoms. 2. There are several over-the-counter and prescription medications available to treat this. You should discuss this with your healthcare provider. 3. Have you had any X-rays or other tests to determine if you have cancer or some other serious illness? 4. Acid reflux at night can lead to serious complications. You need to have tests done to determine the cause. The correct answer is 2. There are several over-the-counter and prescription medications available to treat this. You should discuss this with your healthcare provider. PPIs, H2 blockers, and antacids all treat the symptoms of acid reflux. The nurse should encourage the client to discuss which medication is best with the HCP. Sometimes losing weight will help relieve symptoms, but the client did not ask about lifestyle modifications. The symptoms do not indicate cancer. The nurse should not scare the client. Acid reflux can lead to complications, including adult-onset asthma, that should be treated, but most HCPs will empirically treat the symptoms of acid reflux before ordering tests to determine the cause or possible complications. The nurse is teaching the client with type 1 diabetes how to use an insulin pen injector. Which information should the nurse discuss with the client? 1. Instruct the client to dial in the number of insulin units needed to inject. 2. Demonstrate the proper way to draw up the insulin in an insulin syringe. 3. Discuss that the insulin pen injector must be used in the abdominal area only. 4. Explain that the traditional insulin syringe is less painful than the injector pen. The correct answer is 1. Instruct the client to dial in the number of insulin units needed to inject. The insulin pen injector resembles a fountain pen. It contains a disposable needle and insulin-filled cartridge. When the client operates the insulin pen, the correct dose is obtained by turning the dial to the number of insulin units needed. The insulin pen injector does not require drawing up insulin in a syringe. The insulin pen injector can be used in any subcutaneous site where traditional insulin can be injected. Most clients state that there is less injection pain associated with the insulin pen than there is with the traditional insulin syringe. The client with type 2 diabetes has been admitted into the medical department with a wound on the left leg that will not heal. The HCP prescribes sliding scale insulin. The client tells the nurse, "I don't want to have to take shots. I take pills at home." Which statement is the nurse's best response? 1. If you can't keep your glucose under control with pills, you must take insulin. 2. You should discuss the insulin order with your HCP because you don't want to take it. 3. You are worried about having to take insulin. I will sit down and we can talk. 4. During illness, you may need to take insulin to keep your blood glucose level down. The correct answer is 4. During illness, you may need to take insulin to keep your blood glucose level down. Blood glucose levels elevate during times of stress, surgery, or serious infection. The client with type 2 diabetes may need to be given insulin temporarily to help keep the blood glucose level within normal limits. The statement in option 1 is a threatening type of statement and is not the nurse's best response. Insulin may need to be prescribed in times of stress, surgery, or serious infection. Therefore, the nurse should explain this to the client and not refer the client to the HCP. Option 4 is a therapeutic response, and the client needs to have factual information. Therapeutic responses are used to encourage the client to ventilate feelings. The nurse in a medical unit has received the morning report. Which medication should the nurse administer first? 1. Pantoprazole to a client on call to surgery. 2. Calcium carbonate to a client reporting indigestion. 3. Bismuth to a client diagnosed with an ulcer. 4. Famotidine to a client diagnosed with gastroesophageal reflux disease. The correct answer is 1. Pantoprazole to a client on call to surgery. Pantoprazole is a proton pump inhibitor. A medication for a client on call to surgery is a priority. The client's surgery could be delayed if the medication has not been administered when the call to surgery comes. Calcium carbonate is an antacid. This would be the second medication to administer, as this client has a report of discomfort. Bismuth is an antimicrobial. This medication is a routine medication and could be administered at any time. Famotidine is an H2 blocker. This medication is a routine medication and could be administered at any time. The nurse administered 25 units of insulin isophane to a client with type 1 diabetes at 1600 hour. Which intervention should the nurse implement? 1. Assess the client for hypoglycemia around 1800 hour. 2. Ensure the client eats the nighttime snack. 3. Check the client's serum blood glucose level. 4. Serve the client the supper tray. The correct answer is 2. Ensure the client eats the nighttime snack. The nurse needs to ensure the client eats the nighttime snack to help prevent nighttime hypoglycemia. Insulin isophane is an intermediate-acting insulin that peaks 6 to 8 hours after administration. Therefore, the client would experience signs of hypoglycemia around 2200 hour to 2400 hour. A serum blood glucose level would have to be done with a venipuncture, and the blood sample must be taken to the laboratory. If the client needed the blood glucose checked, it should be done with a glucometer at the bedside. The supper tray would not help prevent a hypoglycemic reaction because the insulin isophane humulin N is an intermediate-acting insulin that peaks in 6 to 8 hours. The client diagnosed with type 2 diabetes is receiving the combination oral medication glyburide metformin. Which data indicates the medication is effective? 1. The client's skin turgor is elastic. 2. The client's urine ketones are negative. 3. The serum blood glucose level is 118 milligrams per deciliter. 4. The client's glucometer level is 170 milligrams per deciliter. The correct answer is 3. The serum blood glucose level is 118 milligrams per deciliter. Glyburide metformin contains both the sulfonylurea and biguanide. The serum blood glucose level should be within normal limits, which is 70 to 110 milligrams per deciliter. A level of 118 milligrams per deciliter is close to normal. Therefore, the medication can be considered effective. An elastic skin turgor is expected and normal, but it does not indicate that the anti-diabetic medication is effective. Urine ketones should be negative because there should not be a breakdown of fat in clients with type 2 diabetes, but this does not indicate the effectiveness of the medication. A self-monitoring blood glucose level of 170 milligrams per deciliter is above a normal glucose level. This indicates the medication is not effective. Which statement is the scientific rationale for administering a proton pump inhibitor to a client diagnosed with gastroesophageal reflux disease? 1. PPI medications neutralize the gastric secretions. 2. PPI medications block H2 receptors on the parietal cells. 3. PPI medications inhibit the enzyme that generates gastric acid. 4. PPI medications form a protective barrier against acid and pepsin. The correct answer is 3. PPI medications inhibit the enzyme that generates gastric acid. PPIs inhibit the enzyme that generates gastric acid. Antacids, not PPIs, neutralize gastric secretions. H2 blockers block receptors on the parietal cells. Mucosal barrier agents form a protective barrier against acid and pepsin. The nurse is discussing oral glyburide with the client diagnosed with type 2 diabetes. Which information should the nurse discuss with the client? 1. Instruct the client to take the oral hypoglycemic medication with food. 2. Explain that hypoglycemia will not occur with oral medications. 3. Tell the client to notify the HCP if a headache, nervousness, or sweating occurs. 4. Recommend that the client check the ketones in the urine every morning. The correct answer is 1. Instruct the client to take the oral hypoglycemic medication with food. Glyburide is a sulfonylurea that stimulates the pancreatitis to secrete more insulin. The oral hypoglycemic medication should be administered with food to decrease gastric upset. The client receiving oral hypoglycemic medications can experience hypoglycemic reactions, as can clients receiving insulin. In option 3, these are signs or symptoms of hypoglycemia, and the client should be able to treat this without notifying the HCP. Ketones are a byproduct of the breakdown of fats, which usually does not occur in clients with type 2 diabetes because the client has enough insulin to prevent breakdown of fats, but not enough to keep the blood glucose level within an acceptable level. Which statement is an advantage to administering a histamine 2 blocker rather than an antacid to a client diagnosed with gastroesophageal reflux disease? 1. Antacids are more potent than H2 blockers in relieving the symptoms of gastroesophageal reflux disease. 2. H2 blockers have more side effects than antacids. 3. H2 blockers are less expensive than antacids. 4. H2 blockers require less frequent dosing than antacids. The correct answer is 4. H2 blockers require less frequent dosing than antacids. H2 blockers require less frequent administration than do antacids, which require frequent administration 7 or more times a day for therapeutic effects. The fewer times a client is expected to take a medication, the more likely the client is to comply with a medication regimen. H2 blockers actually block the production of gastric acid and have a longer effect than an antacid. An increase in side effects would not be an advantage. Antacids are usually less expensive than H2 blockers. Which statement best describes the scientific rationale for prescribing metformin? 1. This medication decreases insulin resistance, improving blood glucose control. 2. This medication allows the carbohydrates to pass slowly through the large intestine. 3. This medication will decrease the hepatic production of glucose from stored glycogen. 4. This medication stimulates the beta cells to release more insulin into the bloodstream. The correct answer is 3. This medication will decrease the hepatic production of glucose from stored glycogen. Metformin is a biguanide that works to prevent gluconeogenesis in the liver. The scientific rationale for administering metformin is that it diminishes the increase in serum glucose following a meal and blunts the degree of postprandial hyperglycemia by preventing gluconeogenesis. A thiazolidinedione, pioglitazone, or rosiglitazone, not a biguanide like metformin, is prescribed to decrease insulin resistance. An alpha-glucosidase inhibitor, acarbose or miglatol, is administered to allow carbohydrates to pass slowly through the intestine. Glucophage does not do this. Meglitinide, repaglinide, sulfonylurea, or natglinide is prescribed to stimulate the beta cells to release more insulin into the bloodstream. Which side effects should the nurse explain to the male client who is prescribed cimetidine? 1. The medication can cause indigestion and heartburn. 2. The medication can cause impotence and gynecomastia. 3. The medication can cause insomnia and hypervigilance. 4. The medication can cause Zollinger-Ellison syndrome. The correct answer is 2. The medication can cause impotence and gynecomastia. Cimetidine is an H2 blocker. Over time, Cimetidine can cause males to become impotent, have decreased libido, and have breast development. Cimetidine, an H2 blocker, is used to treat indigestion and heartburn. Cimetidine can cause lethargy and somnolence, not insomnia and hypervigilance. Cimetidine is used to treat Zollinger-Ellison syndrome, a syndrome characterized by hypersecretion of gastric acid and the formation of peptic ulcers. The client diagnosed with type 2 diabetes is prescribed the medication glipizide. Which statement by the client warrants intervention by the nurse? 1. I have to eat my diabetic diet even if I am taking this medication. 2. I will need to check my blood glucose level at least once a day. 3. I usually have 1 glass of wine with my evening meal. 4. I do not like to walk every day, but I will if it will help my diabetes. The correct answer is 3. I usually have 1 glass of wine with my evening meal. Glipizide is a sulfonylurea which stimulates the pancreatitis to secrete more insulin. Sulfonylureas and biguanides may cause an antabuse-like reaction when taken with alcohol, causing the client to become nauseated and vomit. Advise the client to abstain from alcohol and to avoid liquid over-the-counter medications that may contain alcohol. Alcohol also increases the half-life of the medication and can cause a hypoglycemic reaction. The client with type 2 diabetes does not need to walk daily to keep the glucose level within normal limits. Walking 3 times a week will help control stress and help decrease weight if the client is overweight. The client with type 2 diabetes must adhere to the prescribed diet to help keep the blood glucose level within the normal range. Delaying or missing a meal can cause hypoglycemia. The statement in option 1 would not warrant intervention by the nurse. The client should check blood glucose levels to determine if the medication is effective. Therefore, the statement in option 2 would not warrant intervention by the nurse. The home healthcare nurse is caring for a male client diagnosed with a hiatal hernia and reflux. Which data indicates the medication therapy is effective? 1. The client takes the antacid 1 hour before and 3 hours after a meal. 2. The client reports indigestion after eating a large meal. 3. The client states that he did not wake up with heartburn during the night. 4. The client has lost 3 pounds in the past 2 weeks. The correct answer is 3. The client states that he did not wake up with heartburn during the night. Option 3 indicates an improvement in symptoms and that the medication is effective. Option 1 indicates client compliance with the dosing regimen for antacids, not that the medication is effective. The return of symptoms in option 2 indicates the medication is not effective. In option 4, losing weight would not indicate that a medication for hiatal hernia is effective. Which statement best describes the pharmacodynamics of insulin? 1. Insulin causes the pancreas to secrete glucose into the bloodstream. 2. Insulin is metabolized by the liver and muscle and excreted in the urine. 3. Insulin is needed to maintain colloidal osmotic pressure in the bloodstream. 4. Insulin lowers blood glucose by promoting the use of glucose in the body cells. The correct answer is 4. Insulin lowers blood glucose by promoting use of glucose in the body cells. The statement in option 4 explains the pharmacodynamics, which is the drug's mechanism of action or way that insulin is utilized by the body. Over time, elevated glucose levels in the bloodstream can cause long-term complications, including nephropathy, retinopathy, and neuropathy. Insulin lowers blood glucose by promoting the use of glucose in body cells. The pancreas does not secrete glucose. It secretes insulin, which is the key that opens the door to allow glucose to enter the body cells. Glucose enters the body through the gastrointestinal system. The statement in option 2 explains the pharmacokinetics of insulin and how the body metabolizes it and excretes it in urine. Pharmacokinetics is the process of drug movement to achieve drug interaction. Insulin does not maintain colloidal osmotic pressure. Albumin, a product of protein, maintains colloidal osmotic pressure. The nurse is preparing to administer esomeprazole. Which intervention should the nurse implement? Select all that apply. 1. Order an infusion pump for the client. 2. Elevate the client's head of the bed. 3. Check the client's ID with the medication administration record. 4. Check for allergies to cephalosporin. 5. Ask the client his or her date of birth. The correct answers are 2. Elevate the client's head of the bed. 3. Check the client's ID with the medication administration record. And 5. Ask the client his or her date of birth. The head of the bed is elevated for the client to be able to swallow the medication. The nurse must check the medication administration record with the client's ID band to ensure the correct client is receiving the medication. The Joint Commission requires that 2 patient identifiers be used to determine the right patient. Most healthcare facilities use the client's name and date of birth as these identifiers. An IV pump is not needed. Esomeprazole is a PPI, not a cephalosporin. Cephalosporins are a class of antibiotics. The nurse is discussing storage of insulin vials with the client. Which statement indicates the client understands the teaching concerning the storage of insulin? 1. I will keep my unopened vials of insulin in the refrigerator. 2. I can keep my insulin in the trunk of my car, so I will have it at all times. 3. It is all right to put my unopened insulin vials in the freezer. 4. If I pre-fill my insulin syringes, I must use them within 1 to 2 days. The correct answer is 1. I will keep my unopened vials of insulin in the refrigerator. This statement indicates the client understands the medication teaching. Keeping the insulin in the refrigerator will maintain the insulin's strength and potency. Once the insulin vial is opened, it may be kept at room temperature for 1 month. Insulin vials should not be placed in direct sunlight or in a high-temperature area, such as the trunk of a car, because it will lose its strength. Insulin should not be kept in the freezer because freezing will cause the insulin to break down and lose its effectiveness. Pre-filled syringes should be stored in the refrigerator and should be used within 1 to 2 weeks, not 1 to 2 days. The nurse is discharging a client diagnosed with gastroesophageal reflux disease. Which information should the nurse include in the teaching? 1. There are no complications of gastroesophageal reflux disease as long as you take the medications. 2. Notify the HCP if the medication does not resolve the symptoms. 3. Immediately after a meal, lie down for at least 45 minutes. 4. If any discomfort is noted, take an NSAID for the pain. The correct answer is 2. Notify the HCP if the medication does not resolve the symptoms. There may be several complications of gastroesophageal reflux disease. Adult-onset asthma and Barrett's esophagus leading to cancer of the esophagus are 2 complications of gastroesophageal reflux disease. The chance of developing these problems is less if the GERD is adequately treated, but there are no guarantees. The client should be instructed to sit upright for at least 60 minutes following a meal to prevent reflux from occurring. NSAIDs can increase gastric distress. Ulcers caused by NSAIDs use may be asymptomatic, or the symptoms may be attributed to the GERD. The client should use the prescribed H2 receptor blocker, PPI, or an antacid to relieve the discomfort associated with gastroesophageal reflux disease. Which assessment data best indicates the client with type 1 diabetes is adhering to the medical treatment regimen? 1. The client's fasting blood glucose is 100 mg per deciliter. 2. The client's urine specimen has no ketones. 3. The client's glycosylated hemoglobin is 5.8%. 4. The client's glucometer reading is 120 mg per deciliter. The correct answer is 3. The client's glycosylated hemoglobin is 5.8%. A glycosylated hemoglobin gives the average of the blood glucose level over the past 3 months and indicates adherence to the medical treatment regimen. A glycosylated hemoglobin level of 5.8% is close to normal and indicates that the client is adhering to the treatment regimen. The fasting blood glucose level is obtained after the client is NPO for 8 hours. This blood result does not indicate adherence to the treatment regimen. If the client has no ketones in the urine, it indicates that the body is not breaking down fat for energy, but it does not indicate adherence to the treatment regimen. A glucometer reading of 120 mg per deciliter indicates a normal blood glucose level, but it is a one-time reading and does not indicate adherence to the medical treatment regimen. The adult client recently has been diagnosed with asthma. Which medication is recommended to treat this problem? 1. Omeprazole daily. 2. Amoxicillin twice daily. 3. Loratadine daily. 4. Prednisone daily. The correct answer is 1. Omeprazole daily. Omeprazole is a PPI. Up to 90% of adult-onset asthma is the result of gastroesophageal reflux disease. Treating gastric reflux will treat asthma. Amoxicillin is a penicillin-derived antibiotic. The client is diagnosed with asthma, not an infection. There is no reason to administer an antibiotic. Loratadine is an antihistamine. Antihistamines such as Claritin are used to treat allergic reactions to pollens, dust, or other irritating substances. They are not effective against asthma. Prednisone is a glucocorticoid. Glucocorticoids are prescribed daily for clients with chronic lung diseases, such as emphysema or chronic bronchitis. A client with asthma would not be prescribed a daily steroid. The nurse in the medical department is preparing to administer insulin Lispro to a client diagnosed with type 1 diabetes. Which intervention should the nurse implement? 1. Ensure the client is wearing a Medic Alert bracelet. 2. Administer the dose according to the regular insulin sliding scale. 3. Assess the client for hyperosmolar, hyperglycemic, non-ketotic coma. 4. Make sure the client eats the food on the meal tray that is at the bedside. The correct answer is 4. Make sure the client eats the food on the meal tray that is at the bedside. Insulin Lispro peaks in 30 minutes to 1 hour. Therefore, the client needs to eat when or shortly after the medication is administered to prevent hypoglycemia. Because the client is in the hospital, the client must have a hospital identification band. A Medic Alert bracelet would be needed when the client is not in the hospital. Insulin Lispro is not regular insulin, it is fast-acting insulin. It is not administered according to the regular insulin sliding scale. The peak time for insulin Lispro is 30 minutes to 1 hour. Regular insulin peaks in 2 to 4 hours. A client with type 1 diabetes will experience DKA. A client with type 2 diabetes will experience hyperosmolar, hyperglycemic, non-ketotic coma. The client diagnosed with ulcerative colitis is prescribed mesalamine. Which information should the nurse discuss with the client? 1. Explain to the client that undissolved tablets may be expelled in stool. 2. Discuss the importance of taking the medication on an empty stomach only. 3. Tell the client to avoid drinking any type of carbonated beverages. 4. Instruct the client not to crush, break, or chew the tablets or capsules. The correct answer is 4. Instruct the client not to crush, break, or chew the tablets or capsules. Mesalamine is an aspirin derivative. The tablets must be swallowed whole because they are specially formulated to release the medication after it has passed through the stomach. The client should notify the HCP if undissolved tablets or capsules are found in the stool because this is not expected. This medication can be taken with or without food. Food does not affect the effectiveness of the medication. There are no restrictions on foods, beverages, or activities when taking this medication unless the HCP directs otherwise. The client newly diagnosed with type 1 diabetes asks the nurse, "Why should I get an external portable insulin pump?" Which statement is the nurse's best response? 1. It will cause you to have fewer hypoglycemic reactions, and it will control blood glucose levels better. 2. Insulin pumps provide an automatic memory of the date and time of the last 24 boluses. 3. The pump injects intermediate-acting insulin automatically into the vein to maintain a normal blood glucose level. 4. The portable pump is the easiest way to administer insulin to someone with type 1 diabetes and is highly recommended. The correct answer is 1. It will cause you to have fewer hypoglycemic reactions, and it will control blood glucose levels better. A portable insulin pump is a battery-operated device that uses rapid-acting insulin, Lispro, Humalog, or Novolog. It delivers continuous release of a small amount of insulin and bolus doses with meals. This provides fewer hypoglycemic reactions and better blood glucose levels. The pumps do provide a memory of boluses, but that is not the nurse's best response to explain why a client should get an external portable insulin pump. External portable insulin pumps are only used to deliver rapid-acting insulin subcutaneously. Intermediate and long-acting insulins are not used with an external portable insulin pump because of unpredictable control of blood glucose. The insulin pump is not recommended as the initial way to administer insulin because the success of the insulin pump depends on the client's knowledge and compliance. Initially, most clients start injecting insulin with a syringe and then graduate to the pumps. The client diagnosed with inflammatory bowel disease is prescribed sulfasalazine. Which intervention should the nurse implement when administering this medication? 1. Ensure the client drinks at least 2,000 milliliters of water daily. 2. Administer the medication once a day with breakfast. 3. Explain that the medication may cause slight bruising. 4. Assess the client's stool for steatorrhea and mucus. The correct answer is 1. Ensure the client drinks at least 2,000 milliliters of water daily. Sulfasalazine is a sulfonamide antibiotic. Increasing fluid intake dilutes the drug, which helps to prevent crystalluria from occurring. The medication is administered every 6 to 8 hours, not once a day. Instruct the client to report any bruising or bleeding because it could be a sign of a drug-induced blood disorder. This medication will not cause fat, frothy stools. Therefore, the nurse does not need to assess the stool. The client diagnosed with type 1 diabetes is reporting a dry mouth, extreme thirst, and increased urination. Which interventions should the nurse implement? Select all that apply. 1. Administer 1 amp of IV 50% glucose. 2. Prepare to administer IV regular insulin. 3. Inject insulin isophane subcutaneously in the abdomen. 4. Hang an IV infusion of D5W at a keep open rate. 5. Check the client's blood glucose level via a glucometer. The correct answers are 2. Prepare to administer IV regular insulin, and 5. Check the client's blood glucose level via a glucometer. The client's signs and symptoms indicate the client is experiencing diabetic ketoacidosis, which is treated with IV regular insulin. These are signs, symptoms of DKA. Therefore, checking the client's blood glucose level is an appropriate intervention. 1 amp of 50% glucose would be used to treat a severe hypoglycemic reaction, and this client does not have signs or symptoms that indicate hypoglycemia. In fact, the client has signs and symptoms of hyperglycemia. Insulin isophane is an intermediate-acting insulin, which is not used to treat hyperglycemia. An IV of D5W would cause the client to have further signs and symptoms of DKA. Therefore, the nurse should not administer the IV. The client diagnosed with severe ulcerative colitis is prescribed azathioprine. Which assessment data concerning the medication warrants immediate intervention by the nurse? 1. Reports of a sore throat, fever, and chills. 2. Reports of 10 to 20 loose stools a day. 3. Reports of abdominal pain and tenderness. 4. Reports of dry mouth and oral mucosa. The correct answer is 1. Reports of a sore throat, fever, and chills. Azathioprine is an immunosuppressant and can cause a decrease in the number of blood cells in the bone marrow. Signs or symptoms that would warrant intervention by the nurse include sore throat, fever, chills, unusual bleeding or bruising, pale skin, headache, confusion, tachycardia, insomnia, and shortness of breath. 10 to 20 loose, watery stools a day are characteristic of an acute exacerbation of ulcerative colitis and would not warrant intervention by the nurse secondary to the medication. Abdominal pain and tenderness are characteristic of an acute exacerbation of ulcerative colitis and would not warrant intervention by the nurse secondary to the medication. Dehydration may occur with ulcerative colitis, but it does not warrant intervention by the nurse secondary to the medication. The nurse administered 12 units of regular insulin to the patient with type 1 diabetes at 0700 hour. Which meal prevents the client from experiencing hypoglycemia? 1. Breakfast. 2. Lunch. 3. Supper. 4. Nighttime snack. The correct answer is 1. Breakfast. Regular insulin peaks in 2 to 4 hours. Therefore, the breakfast meal would prevent the client from developing hypoglycemia. Lunch would cover an 0700-hour dose of insulin isophane, an intermediate-acting insulin. Supper would cover a 1600-hour dose of regular insulin, a short-acting insulin. The nighttime snack would cover a 1600-hour dose of insulin isophane, an intermediate-acting insulin. The client diagnosed with a severe acute exacerbation of Crohn's disease is prescribed total parenteral nutrition, TPN. Which interventions should the nurse implement when administering TPN? Select all that apply. 1. Monitor the client's glucose level every 6 hours. 2. Administer the TPN on an IV pump. 3. Assess the peripheral IV site every 4 hours. 4. Check the TPN according to the 6 rights prior to administering. 5. Encourage the client to eat all of the food offered at meals. The correct answers are 1. Monitor the client's glucose level every 6 hours. 2. Administer the TPN on an IV pump. And 4. Check the TPN according to the 6 rights prior to administering. TPN is 50% dextrose. Therefore, the client's blood glucose level should be checked every 6 hours. Sliding scale regular insulin coverage is usually ordered. TPN should always be administered using an IV pump and not via gravity. Fluid volume resulting from an overload of TPN could cause a life-threatening hyperglycemic crisis. TPN must be administered via a subclavian line because a peripheral line will collapse as a result of the hyperosmolarity of the TPN and phlebitis may occur. The client with severe acute exacerbation of Crohn's is NPO to rest the bowel. When on TPN, the client is usually NPO because the TPN provides all necessary nutrients. Therefore, the nurse would not encourage the client to eat food. The nurse is teaching a client with newly diagnosed type 1 diabetes about insulin therapy. Which statements indicate the client needs more teaching concerning insulin therapy? Select all that apply. 1. If I have a headache or start getting nervous, I will drink some orange juice. 2. If I pass out at home, a family member should give me a glucagon injection. 3. Because I am taking my insulin daily, I do not have to adhere to a diabetic diet. 4. I will check my blood glucose with my glucometer at least once a day. 5. I should administer my insulin in my abdomen for best absorption. The correct answer is 3. Because I am taking my insulin daily, I do not have to adhere to a diabetic diet. Even with insulin therapy, the client should adhere to the American Diabetic Association diet, which recommends carbohydrate counting. The statement in option 3 indicates the client needs more teaching. Headache, nervousness, sweating, tremors, and rapid pulse are signs of a hypoglycemic reaction and should be treated with a simple acting carbohydrate, such as orange juice, sugar-containing drinks, and hard candy. If a client cannot drink or eat a simple carbohydrate for hypoglycemia, then the client should receive a glucagon injection to treat the hypoglycemic reaction. Monitoring and documenting the blood glucose level is encouraged to determine the effectiveness of the treatment regimen. The abdominal area best absorbs insulin. Therefore, the client does not need more teaching. The client diagnosed with inflammatory bowel disease, taking mesalamine reports, nausea, vomiting, and diarrhea. Which intervention should the clinic nurse take? 1. Instruct the client to quit taking the medication immediately. 2. Tell the client to take lansoprazole with the medication. 3. Advise the client to keep taking the medication, but notify the HCP. 4. Explain that these symptoms are expected and will resolve with time. The correct answer is 3. Advise the client to keep taking the medication, but notify the HCP. Mesalamine is an aspirin derivative. These are side effects of the medication, and the HCP should be notified, but the client should not stop taking the medication. The client should not quit taking the medication abruptly because that would result in an acute exacerbation of the inflammatory bowel disease. Lansoprazole is a PPI. A PPI will not help treat these symptoms. These symptoms will not resolve with time and should be reported to the HCP.
you can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.